neurodegenerative disease of the CNS. It is a neurodegenerative disorder or a group of disorder characteristic by cellular degenerations of subset of the neuron, typically are related by functions rather than by physical locations in the brain. Many of these disorders associated with accumulations of neuronal protein, which serve as histological hallmark of specific disorder. Familiar form of this disease characteristic by the presence of the mutations in the gene encoding of this protein and controlling their metabolism. Neurodegenerative disease is caused by symptoms that, depending on the patterns of the brain involved. Cerebral cortex disease usually manifested as cognitive change, alterations in personality, memory disturbance, language, components of dementia. Most common type of it is Alzheimer's disease. Basal ganglia disorder manifested by hectic tongue disease and Parkinson disease. These are affecting cerebellar characteristic by ataxia. Those affecting by the motor neuron resulted in weakness. Parkinson disease, one of a common disease, degenerative disease, clinically presented. It is a clinical symptom by reduce of the facial expressions, mask face, stupor posture, slowness of the voluntary movement, progressive shortening, accelerated step, rigidity, and peer rolling tremor. These motor disturbances associated with damage into the dopaminergic neuron in substantia. Not necessarily all of the symptoms is occur collectively. In some cases, there is accelerated in one symptom rather than into the other. Parkinsonism, this can be induced by drug and toxic material like the dopaminergic antagonist, selectively injured into the dopaminergic neuron. Among the neurodegenerative disease, most cases of Parkinson's is caused by Parkinson disease, which is associated with characteristic neuronal inclusions containing a-synuclein protein. Other disease in which Parkinson's is may be present, multiple systemic atrophy, in which this alpha-synuclein aggregated are found in oligodendrocytes, a progressive supranuclear palsy, and corticobasal degenerative, which are both associated with tau protein containing inclusions body in glial cell. Postencephalitic Parkinson, that's denoted in pandemic influenza in 1980. Pathogenesis behind the development of Parkinson disease. Parkinson disease is the most cases is sporadic, but autosomal dominant and recessive forms can be present. Both familiar and sporadic form diagnostic features of this disease by the presence of the Lewy body. Inclusions contain alpha-synuclein. Point mutations and duplications of this gene encoding alpha-synuclein, a protein involved in sympathetic transmissions, cause autosomal dominant Parkinson disease. Two other causative genetic loci encoding the protein parkin. Morphologically, typically close finding in autopsy, pallor of the substantia nigra and locus cerularis. Microscopical features include loss of the pigmented catecholaminergic neuron in this region associated with the gliosis. Lewy body may be found in these neurons that remain. These are single or multiple intracytoplasmic eosinophilic rounded elongated inclusions body resulted from aggregations of abnormal protein alpha-synuclein that often have a dense core surrounding by pale halo. This other major histological finding, Lewy neurites, with dystrophic neurites that also contain abnormal alterations of the abnormal protein, which is an alpha-synuclein. This other major histological finding, Lewy body neuritis, Lewy body presence, dystrophic neuritis, is also contain abnormal alterations of alpha-synuclein. Lewy body and Lewy body neuritis eventually appear in cerebral cortex and subcortical area. Parkinson's disease commonly manifested as movement disorder, absence of the toxic exposures of other non-underlying the disease usually progressed over 10 to the 15 years, in some cases into the 18 years, eventually producing severe motor slowing to the point to the near immobility. And we have in some cases that's called an Parkinson plus, which has an aggressive behavior and an aggressive presentations with a short time, maybe to 5 years long. Death usually is resulted from intercurrent infections or trauma from frequent fall causing by postural instability. This is an cross picture will show in the A there is normal substantia nigra, in B the depigmentations look into the absence of the dark pigment present in A pictures. Lewy body neuritis or Lewy body in the neuron from the substantia nigra, this is appear as stain in pink in arrow. I believe normal number of the neuron substantia nigra and which are pigmented, dopaminergic neuron, and less few sparse disturbance of pigmented present in the other pictures. This is in Parkinson's disease in the right view. Dementia, typically with a mild fluctuations caused and hallucinations emerging in many persons with Parkinson's disease, maybe because of the disease and maybe because of the side effects of the drug correcting of the disease, and as attributed to involvement of cerebral cortex. When dementias arise within 1 year of the onset of the motor symptom, it's referred Lewy body dementia. Huntington disease. It is a degenerative of stratum, quadrate, and Potman. The movement disorder is a coriform dancey-like movement with increased and involuntary jerky movement of all parts of the body. Writing movement of the extremities are typical. The disease is progressive, resulted in the death after average course of the 15 years. Pathogenesis. It's resulted from CAG, trinucleotide repeats. For the gene to be expressed, we need a 3 nucleotide to be expressed. Every gene encoding a protein, it have a limited time, a limited number of bases, like 10, 20, 100, according to the type of the gene affecting. In some disorder, when the repeated nucleotide or trinucleotide that are more than the normal range, يعني ممكن أن يصير ضعف، ضعفين، 3 أضعاف, resulted in syndrome or clinical syndrome is called trinucleotide repeat expansion. According to the type of the genes or trinucleotide has been involved, the symptom will be appear. In this disease, there is an increase or expansions of trinucleotide repeat, the CAG, located in the short ample chromosome part that encoding the protein Huntington. Normal allele contain 11 to 34 copies. Repeat. Disease cause allele number of repeat increase, sometimes into the 100 number. This is strong genotype-phenotype correlated with a large number of repeat resulted in earlier onset of disease. When the symptoms appear, however, the course of illness is not affected by repeated length. Further expansions of pathological CAG repeat, it can be occur during spermatogenesis. So paternal transmissions, it may be associated with earlier onset in the next generation's phenomena referred as anticipation. Huntington disease appears to be caused by toxic gain of functions of mutations related to the expansions of the polyglutamate tract in Huntington protein. This is a picture. In the above show the normal expansions 10 to the 26, 34 accordingly, and in the lower one is disease that may be reached into the 80 and sometimes into the 100 trinucleotide repeat. Normally 40 allele with reduced pentarence. That means an effect of the mutations has been appear in the genes. Mutant normal allele 27 to 35 with normal allele 26. Look into the normal expansions with normal number, and when there is an increase a trinucleotide expansions resulted in formations of disease. Morphologically, cross-examination, the brain small shows strictly atrophy in the caudate nucleus and sometimes less dramatically in the Postencephalitic. Pathogenic change developed over the course of this illness in the medial and lateral directions in the caudate and from dorsal to ventral in the Postencephalitic. Globus pallidus is maybe atrophied secondary and ventricular are dilated. Atrophy frequently is also seen in the frontal lobe. Macroscopically reveals severe loss of the neuron from affecting regions, resulted from an abnormal Huntington protein from trinucleotide expansions of its gene. So the code is abnormal. The protein presence or the protein product is abnormal. This is abnormal protein lead into the degenerations of the neuron encoding for this protein. Also seen in the fibrillary gliosis, in which more extensive than the usual reactions to the neuron loss. There are an intranuclear inclusions containing aggregations of ubiquitinated Huntington protein. This is the normal cerebral hemisphere in the left, with atrophy of stratum and ventricular dilatations in the right. The atrophy resulted from degenerative change.